I'm Lucy. I was a participant in the PACKmAN trial. One day I was out bouldering at one of my regular bouldering gyms, and I was climbing on an overhang and fell onto my elbow and dislocated my right elbow. One of the other members of the gym went to get the staff, who then called the paramedics out. The staff at the gym helped me over to a seat and gave me an ice pack while we waited for the paramedics to come round. When the paramedics came, they asked me if I needed anything to drink, if I needed anything to eat, because I was in a lot of pain. And they tried to move my arm and they couldn't move it because I was in quite a lot of pain, and trying to put it back in place, it just didn't seem possible for them. Yeah, they put a vacuum splint on my arm, and then they gave me some gas, and they carried me out to the ambulance. I don't really remember much about the pain relief being given. I remember receiving an injection. I also remember the paramedics, I think they gave me a little card or something briefly describing the PACKmAN trial and what it kind of entailed. And then they asked if I wanted to be involved in this trial. And then they gave me either the morphine or the ketamine, I think. They were quite happy to talk to me about the trial. And then after I was discharged from the hospital, I was contacted by a member of the West Midlands Ambulance Service, a woman called Zoe, asked if she could come round to discuss in more detail about the trial. And at that point, she got me my fully informed consent to be involved on the study, and told me about the follow-ups that would be involved as well. So there was a 3-month and a 6-month follow-up. Both of them were done over the phone, in which I answered kind of a questionnaire regarding current pain levels and any kind of changes in my quality of life. Pain is something that is always going to be a problem. It's something that will affect people in different ways. People have different tolerances, different levels of pain, and I think it's important that we find pain relief that works for everyone, regardless of kind of their situation, because obviously I didn't plan to fall and dislocate my elbow. Most people don't plan those kinds of things, but obviously things like that can also be applied to potentially chronic pain as well that's untreated as well. So that's why I think it's quite important. I think it's really good that they do. It means that they're trying to develop, they're trying to improve, obviously try and make our NHS as good as it can be. I think it's really great that they're involved in these kinds of trials.